All right, so my talk is going to be breast cancer in young women and what to consider. No disclosures. All right. So hopefully, by the end of these 20 minutes, you'll learn more about the epidemiology and prognosis of these patients, and also able to discuss treatment and survivorship issues with these patients. So what I will cover are who are the young women that are affected, what's the prognosis, should you change your therapy based on this young age, and what are some of the survivorship issues these young women face. I will not cover radiology, genetic testing results, surveillance, and chemotherapy. That's just too much to do in 20 minutes. But I think the first set of 4 points are more practical for a surgeon who does breast surgery. So when you look at the incidence of breast cancer, you can see here that, as expected, the older you get, the incidence increases. And we look at the young age, women less than 40, the number is about 6.6%. So it's not that many women are getting it. And when you look at the less than 35, it's 2.4%. So even though you may be in your practice seeing young women with breast cancer, the overall incidence is really quite low. And we look at time, so you look at the past 25 years, we see that older patients, the incidence is increasing, but for young patients, if you look at those 4 plots, it's basically flat, meaning that the incidence per million people in the 70s, 80s, and 90s is essentially flat. So we're not seeing more women with diagnosed with breast cancer at a young age. We look at the race and socioeconomic status of these women. We know that black women, less than 35, have twice the incidence of breast cancer and 3 times the mortality compared to their white counterparts. And we also know that a low socioeconomic status, i.e. poor access to care, patients have an increased risk of presenting with advanced disease. So what's the role of genetic testing? So if you're a breast cancer patient less than the age of 35 and you get tested for the BRCA1 or 2 mutation, your risk is 9.4%, hint, MOC, compared to the population, which is 0.2%. If you have a family history and you're diagnosed with breast cancer before the age of 35, your odds of having a mutation of significance, BRCA1